So now we shall be discussing about another opportunistic fungal infection, that will be Cryptococcus neoformans. So we shall be discussing about Cryptococcus neoformans. Now in this Cryptococcus neoformans, right, we as usually, as I told you, we shall be discussing the shape, right? We shall be discussing the morphology. Now when we discuss about the morphology, you have to know that this fungi exists only in single form, like yeast form, okay, whereas remaining fungi exist in both yeast as well as the budding form, right? But this fungus exists only in one form. That is why you call it as, it is a non-dimorphic fungi. It does not have two faces, right? It has only one way of living, only one form of living, that is yeast form, right? So it is a non-dimorphic fungi. Non-dimorphic fungi meaning it has got only one form of living. What is that? It has got only yeast form, right? So yeast form only. Yeast form only. Okay, so it has got a single cell like this. Single cell. Now when you look at the structure of this, how does this look? This is completely circular like this. Okay, completely circular. So this is how it looks. So this is Cryptococcus neoformans, and whatever I'm drawing with the blue color dots here, this is all the capsule. So it is highly encapsulated, right? So this is highly encapsulated. Highly encapsulated, and it has got, look at the base of this. The base is little bit narrow, right? So it has got a narrow base. Basically it is circular, but it has got a little bit narrow base. Okay, now let us look at, let me show you the picture of this, right? Look at the first picture here. So this is Cryptococcus neoformans, and look at the tip of that. Tip of that is little bit narrow like this, right? So even here the tip is little bit narrow. So that's what I was telling you. Okay, now let us look at the virulence factors. What are the virulence factors? Now what are the important virulence factors you would see is, the first important is, it is encapsulated. It is highly encapsulated. So when I tell it is encapsulated, capsule helps in preventing phagocytosis. Whenever there is thick capsule, phagocytes cannot eat it up, cannot attack. So highly encapsulated in the sense there will be decreased phagocytosis or no phagocytosis. Capsule prevents from phagocytosis. Keep that thing in mind. Second important thing is that when I start staining this fungus on a Indian ink, okay, so on Indian ink, what will I find? Look here. On Indian ink stain, I would find this. So this is an Indian ink. So when I use Indian ink, right, so I can see complete halo in the center, right? So I can see like this. I can see a small circle in the center which is completely empty, right? So I can see a clear halo. So this is what I can see as a clear halo. So on Indian ink, I would find a clear halo. Third important thing, I would use another stain that is called as mucicarmine. Okay, that is mucicarmine. Now when I use this stain mucicarmine, I would find red inner capsules. On mucicarmine stain, I would find red inner capsule. Okay, now let us see what are the diseases that are caused. Now let us see what are the diseases that are caused. The first important disease is cryptococcal pneumonia. Cryptococcal pneumonia is the first disease. And second important thing is that meningoencephalitis, very very important. Meningoencephalitis. This will be the second important disease that is caused by Cryptococcus neoformans. Now, in this meningoencephalitis, when you look at the CT of the brain, you would find soap bubble appearance, right? So you would find what? Soap bubble lesions. Soap bubble, find soap bubble lesions of brain. Soap bubble lesions of the brain. Look here. So look at this picture over here. Now in this picture, I can find, you see these small round things, right? I have enlarged them here. So these are soap bubble appearances, nothing but this is the fungus itself. Okay, very important. Soap bubble lesions are very very important. So the final thing, we shall close this topic by discussing the treatment. The treatment obviously it will be amphotericin B. So in all kind of opportunistic fungal infections, you would give amphotericin B as well as flucytosine. So this is all you need to know regarding Cryptococcus neoformans. Thank you so much for watching my video.